Hello everyone, I'm Dr. Pete Crookall, one of the GP partners at Kempsey Surgery. The team and I wanted to take this opportunity to update all of our patients on what is happening with the way that we're working. Following on from Dr. Andy John's update back in May, we thought it would be helpful to share some further changes that have been happening and remind everyone of how you can access our surgery. But first of all, I personally wanted to take this opportunity to say that I hope everyone is keeping safe and managing to cope in these unusual circumstances that we're facing. This has been a very stressful time for frontline NHS services, but we understand it's been very stressful for many of you too. We are grateful for everyone's ongoing support and understanding for how we're having to run the surgery to ensure everyone is kept as safe as possible. Our services and team are still here and available to help. This is still different to normal, but I will now explain how we're currently working. If you need to speak to someone at the surgery, then you can call the practice on our main phone line and select the appropriate option. NHS England are advising practices that we speak to patients over the phone first for any problem, to discuss what help you require and to make any necessary arrangements. To do this, the reception team will book in a phone call where a clinician will be able to speak to you. You can also access our services by using the health advice forms, which is the online consultation system available on our website and on the patient access app or website. Completing a form on here gives us the information we need before a member of the team calls you to discuss your problem. You can do this instead of calling the surgery. It is important that we have your up-to-date contact information and that you're available to take the call when agreed. We have nurse clinics running at Haresfield Surgery for screening programs, vaccinations, blood tests and patient care, in line with infection control measures and NHS England guidance. We have instructions from NHS England about what practices should be offering patients, which will continue to change, but please be reassured we will continue to update patients when these happen. If you're attending for an appointment, we are working extra hard to make every contact count, and for this reason, the nurses may do your annual tests and checks in your appointment slot to prevent some patients having to come to the surgery again later in the year. We will call you to discuss any urgent concerns that you have and for any ongoing discussions and monitoring. If you need to be seen by a doctor, we will arrange this and ask you to attend Haresfield Surgery for an appointment. We have all embraced using technology differently over the last few months, and some of you will be aware we are using different approaches, such as patients emailing and texting photos to us for us to look at. And this helps us to work out whether we need to have a face-to-face appointment or not. You can request your regular medications through the online patient access website or app, or you can email us or post a request. If you have any queries about your medication, we ask that you call the surgery and do not attend the building, as access is still limited to patients attending for an appointment. We must continue this to ensure risks to patients remain low. We are aware that many sectors and businesses are opening and returning to normal, but please be mindful that the surgery helps patients who are often ill and vulnerable, and we are still required to limit access because of this. But we are working on extra measures and a long-term solution for how we will continue to ensure we can look after our own patients. The dispensing team are able to manage routine requests and deliver these within 3 to 4 working days, so please allow this when placing your order. For the time being, we're still delivering medication to all of our patients who live in Kempsey. When attending the surgery for an appointment, you are required to wear a face covering or a mask. Everyone will continue to have their temperature checked at the entrance, and we ask that if you have any symptoms of coronavirus, that you call us and cancel your appointment and make further arrangements with the team. We are unable to provide exemption letters for anyone that cannot wear a mask, and if you have any further questions, then we ask that you consult the government website for further information. If you have any questions about an appointment you're expecting at Worcestershire Royal Hospital or indeed any other hospital, please be aware that you can call the main line of the hospital to be directed to the department you need and the appropriate secretarial team. I hope this information helps explain our current way of working at the surgery and how you can access our services. We want to support you all, and we ask that you continue to support us and our staff, respecting that this way of working is in place as requested of us by Public Health England and the NHS. We will be in touch with any further updates when we make any changes. Please continue to stay safe, and I hope that you're able to enjoy the summer in spite of the current restrictions. Thank you.